I'm Lori Hendrickson. I am a craniosacral therapist based in Minnesota, and I specialize in pediatrics, all things baby, from oral ties to torticollis, plagiocephaly, feeding difficulties, digestive difficulties. And really, what I do is I'm just in the business to make babies more comfortable in their body and make mamas and babies fall in love again. That's my goal. And then teaching all over the United States and Canada.
I
So
love
it,
what you said. It's
yeah,
like just help babies move better in their bodies.
yeah, yeah, babies are really, a lot of babies are confined, many of them are swaddled all night long and then they're put in some contraption. I don't know what you guys have these days, swings and bumble seats and snoo and car seats. And
We
they really need more opportunity to move freely.
so you just kind of and you incorporate a lot of fascial work, like fascial techniques. Like during the seminar, you kind of went over some fascial stretches. How do these stretches also enhance the cranial sacral therapy that you
I
also
really
provide?
believe that it frees up the baby to even receive the cranial sacral work. Some of these babies are so locked down in their fascia, it's just adhered. Just because baby hasn't been able to move freely and work out all of those fascial adhesions, I have found in my practice over the years that if we do a little bit of softening, connective tissue softening, fascia release stuff, very gentle, that baby almost immediately is more comfortable and then open to receiving some deeper kind of work, whether it be chiropractic adjustments, PT, craniosacral, whatever it is. Let's get them comfortable first and let them show us what they need.
For sure. Yeah. And so can you explain kind of the foundational benefits of cranial sacral therapy to like newborns, infants, if no one's just has is just new to cranial sacral therapy?
Well, it's just one step deeper, I think, than chiropractic. So think underneath the muscle and underneath the bone. And in class, I use an illustration of a jellyfish because I think that's really something good to have in our mind's eye. We want that jellyfish to be just free and floating within the body fluids and the cerebral spinal fluid. And to do that, baby really needs to be able to move so that she can adjust herself, her positioning. She can help move her gas out either this way as a burp or the other way. It's really very simple. It's getting them comfortable, getting them moving, and then I think they give us a much more clear idea if of what it is that they need help with, if they even do. But sometimes, if babies have had a lot of restriction for whatever reason, they're not comfortable enough to even work it out by themselves in a prone position. And so that's where these fascia release techniques, very gentle, we can call them whatever anybody's comfortable with. It's really very gentle movements, just getting them used to bringing that arm up because it hasn't been expressed, like it would have had she had more opportunity outside of a swaddle or outside of a container. Moms and dads are busy right now. I think that they're busier than they've ever been. And so it's easy to put baby somewhere where she'll just be quiet. And that's okay when we need to get something done. But for the majority of the time in a day, I think they really need to move more than they're being allowed to right now. So that's a big message. And we talk about that in class too.
What are some like signs and symptoms that maybe a parent could look for that may suggest that their newborn or infant would benefit with this care?
Well, in my experience, parents seek out care when babies are crabby. Especially when they're inconsolable, and not just the witching hour at supper when everyone's trying to eat, but pretty uncomfortable all day long. Don't feed right. They're not digesting their food gracefully. Um, Everybody in the house is a wreck because when the baby's a wreck, everybody's affected. So I think that's it. I mostly get people, I'm so, like, what's going on? Well, they usually don't say, oh, nothing, she's wonderful. They're like, help, help me. So I would say that would be it, crabby babies.
And you talked a lot about like torticollis and
Mhm.
how like even the fascial those releases can really help with that, like releasing. So those are like also some signs that people can look for, right? Like
Yes, and the torticollis, there's lots of reasons. And there's intrauteral, intrauterine restriction that can cause that too. But I really believe that if a baby even has that restriction in utero, but they're allowed to move and work it out, it doesn't present itself, for weeks and months on end. But also, if they're swaddled all night long and they're constantly on their back, their head can tend to just fall to one side or the other. And that's when you get all of these muscles here that are shortened and a little bit atrophied. Yeah. So movement helps with that.
movement, and you do such a good job at also teaching the parent too. Like you can
Yes.
only do so much in that 20-40 minute appointment
Right.
in the parent.
Right. And so I make sure that my appointment times with babies, when I do treat babies, isn't all about teaching the parents, or we wouldn't get a lot of work done. So what I do and what I encourage all my students to do is I make really short videos of me going through some of these movements that I typically recommend for parents as they're trying to get their baby more comfortable. And I use a doll. Here she is. I use a doll and I make little short videos, like I said, and then I either airdrop them to the parents or text them to them, however they need it. But some of my practitioners, some of you young girls have thought of much better ways. QR codes, having it on your website, having it on your desktop so that your desk person can, hand them out as they leave. But I try to make it as approachable and efficient as I can so that the parents get the tools that they need. So right away when they get home and that baby's already feeling softer and baby's already a little bit happier, that right there encourages them. Oh, I want to do whatever she did because baby's never been this happy. And so getting them that little video, one or two little movements that they can do in between appointments, you're going to see significantly better outcomes.
So how would you explain craniosacral to like a so a lot of parents come in, like I do craniosacral and they're like, well, what are you doing? Like, what do you feel? What do and how would you just explain that to like a parent?
That's when I get out the little jellyfish.
And
I have those little jellyfish that I show in class, and I talk about it kind of ad nauseum on my IG account too, but I just make it very simple and approachable. Like, this is what's going on. There's this kind of map of fascia, and it's kind of like a jellyfish. And I really believe that it's just stuck in some places, you know? And with practitioners, when you and I are discussing patients, we can say, oh, diaphragmatic adhesions, some fascial adhesions here, maybe the sigmoid colon, ileocecal valve, pyloric sphincter. But with moms and dads, let's just keep it easy and talk mostly about softening baby and getting her more comfortable. And they're right on board because they realize that she's not happy.
hopefully
Mhm.
we just keep sharing more and more about what we're seeing, even in practice,
Yeah.
and the impact that we can make so we can really continue to share what you do. And you also see patients out of your
Out
clinic,
of my home. Yep.
out
Just
of your home.
babies. Yep.
Okay.
I do. Usually a referral basis. I'm usually getting them from my midwives and my dentists. Yeah.
Thank you, Lori.
You're
You're
welcome.
an inspiration to all of us and just your knowledge. And it was really fun learning from you